So what we're looking at now is we're going to assess the actual range of movement the side has in his knee. So first of all, I'm going to ask him to try to squash his bottom of his knee down towards the floor. Okay. And what we have, naturally we'll have a little gap here anyway. His quads won't be firing as best as they can through what we call inhibition, through pain. He's also got the brace on, which is slightly restricted. What I'm going to ask him to do now is bend his knee as much as he can. That's good, and he's almost achieving that full 90 degrees that we've been looking for. The brace is locked to restrict his knee to move from 90. Now that's not standard with an ACL reconstruction, but because of his meniscectomy, the surgeon has recommended that we don't go beyond that for the first 4 weeks of his recovery. That will be reviewed in about 12 days' time, and if he's making great progress, the surgeon may allow him greater range of movement, which I'm going to be able to. Let's straighten out again. Fantastic. And then again. So this will be an exercise that I'll get him to do at home, with or without trainers on, sliding his heel through the floor and back out again, really working on squeezing the quads down towards the ground so we get a nice thigh contraction at the top, and then bending up and back, again as pain allows. Good, and back away. At this stage, we don't advise any kind of medications like ibuprofen. He could take some paracetamol for pain management, but I'd like him really to wean off painkillers so that he can really feel a sense of what his knee is doing and how it's reacting. Swelling will be his biggest enemy, so we want to work through that. Okay. The other thing that I'll get him to do is what we talked about before about his swelling management. So I'll get him lying flat on his back, and I'll ask him to try to lift his leg straight up into the sky. And I'd assist and help him. Now this could be resting on the back of a sofa or up against a wall. What it will help is the knee to keep straight, but it would also allow blood flow down this way. Now I'd also maybe get him to add an ankle pump where he pumps up and down, and as vigorously as he feels he can, just to help the pump action that we get naturally from our calf muscle. This is really good. I'd get him to do that for about 10 minutes, and then I'd slowly get him to lower his knee back down to the ground. All the way. Now if he's not able to do that, if the strength in his quads don't allow him to do that, that's fine. He can use his stronger good leg to slide underneath and help assist with the lift. And that looks something like this. So he can come all the way up like so, or he can even cross them over at the ankle if he feels that there's less support. And this way he can also pivot and maneuver in and out of bed by sliding around on his bottom, keeping the foot supported, and down and rest. Perfect.